Hello and welcome to our channel and video on the signs of heart disease. In this video, we will be discussing 10 popular questions related to heart disease. We will cover topics such as the early warning signs of heart disease, the role of genetics, the symptoms of a heart attack in women, and much more. So, if you want to learn about the warning signs of heart disease and how to prevent it, keep watching. Don't forget to hit that subscribe button and give this video a thumbs up before we continue. We appreciate your support and want to make sure we're creating content that you enjoy. Now, let's get back to the video. So, what are the early warning signs of heart disease? One of the most important things you can do to prevent heart disease is to be aware of the early warning signs. Some of the most common early signs of heart disease include chest pain, shortness of breath, and fatigue. These symptoms may not seem like a big deal at first, but they can be an indication of a more serious condition. If you experience any of these symptoms, it's important to speak with your healthcare provider. They may recommend lifestyle changes or medication to help manage your symptoms and prevent further complications. Can chest pain be a sign of heart disease? Chest pain is one of the most well-known symptoms of heart disease, but it's important to note that not all chest pain is related to heart problems. Chest pain caused by heart disease may feel like pressure or tightness in the chest, and it may be accompanied by shortness of breath or nausea. If you experience chest pain that is severe or lasts longer than a few minutes, seek medical attention immediately. It's always better to be safe than sorry when it comes to your heart health. What role does genetics play in heart disease? Genetics can play a role in your risk for heart disease. If you have a family history of heart disease, you may be at a higher risk for developing the condition. However, just because heart disease runs in your family doesn't mean that you will develop it. It's important to discuss your family history with your healthcare provider, as they may recommend additional screening or lifestyle changes to help reduce your risk. How can high blood pressure contribute to heart disease? High blood pressure, also known as hypertension, is a common risk factor for heart disease. Over time, high blood pressure can damage the blood vessels and increase your risk of heart attack and stroke. If you have high blood pressure, it's important to work with your healthcare provider to manage your condition. This may involve medication, lifestyle changes such as exercise and diet, or a combination of both. What are the symptoms of a heart attack in women? The symptoms of a heart attack can be different in women compared to men. Women may experience symptoms such as shortness of breath, nausea, or back pain, in addition to the more typical chest pain. It's important for women to be aware of these symptoms and seek medical attention if they occur. Early intervention can improve outcomes and reduce the risk of complications. Can stress contribute to heart disease? Chronic stress can have a negative impact on your heart health. When you experience stress, your body releases hormones that can increase your blood pressure and heart rate. Over time, this can lead to damage to your blood vessels and increase your risk for heart disease. It's important to find ways to manage stress in your life, such as exercise, meditation, or spending time with loved ones. If you're struggling with stress, don't hesitate to reach out to a healthcare professional for support. How does smoking affect heart health? Smoking is a major risk factor for heart disease. When you smoke, chemicals in tobacco can damage your blood vessels and increase your risk of developing plaque buildup. This can lead to a heart attack or stroke. If you smoke, it's important to quit as soon as possible. Your healthcare provider can help you develop a plan to quit smoking and reduce your risk for heart disease. What is angina and how is it related to heart disease? Angina is a type of chest pain that can be a symptom of heart disease. It's often described as a feeling of pressure or tightness in the chest, and it may be triggered by physical activity or stress. If you experience angina, it's important to speak with your healthcare provider. They may recommend lifestyle changes or medication to help manage your symptoms and prevent further complications. Can a healthy lifestyle prevent heart disease? Maintaining a healthy lifestyle is one of the most effective ways to prevent heart disease. This includes eating a balanced diet, exercising regularly, not smoking, and managing stress. By making these healthy choices, you can improve your heart health and reduce your risk of developing heart disease. What are the warning signs of a stroke? In addition to the warning signs of heart disease, it's important to be aware of the warning signs of a stroke. These can include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, and sudden vision changes. If you or someone you know experiences these symptoms, seek medical attention immediately. We've covered 10 popular questions related to heart disease, including the early warning signs, the role of genetics, and lifestyle factors such as smoking and stress. Remember, if you're experiencing any of the symptoms we've discussed, it's important to speak with your healthcare provider. And if you want to learn more about how to maintain good heart health, be sure to subscribe to our channel and give this video a like.